If you want to get started, that sounds great.
Okay, I want to be respectful of everybody's time, so I wanted to just introduce myself really quickly, and then I'm going to let Yona run the show. My name's Eliza Norwood. I'm an assistant professor of internal medicine and population health at the medical school, and I work at community care clinics. And I am leading the Pop-Up Institute on sexual and gender diverse research opportunities. We're dubbing it the Pride Health UT Pop-Up Research Institute. So in collaboration with a lot of other departments throughout the University of Texas, our goal is to increase research that benefits sexual and gender diverse communities in Austin and Central Texas. And that is community-led research. So we wanted to start this whole session, a virtual Pechakusha series, we're calling it, of kind of short summaries of what people are doing in terms of their research projects that focus on these communities. And we thought it most appropriate to start with voices from the community. So I want to thank Yona for organizing all of this. She has been really tireless in her work and her outreach. And I also want to give a huge shout out and thanks to all of the community organizations that have agreed to spend their time putting together these presentations and teaching us about what they're doing. This is, we know it's been a really difficult time for everybody, and we want to make sure that we are aware of how the University of Texas and researchers can be adding to and helping the community organizations do what they do best. So without further ado, I'm going to hand it off to Yona, and I want to say to everybody who is on this call, if you want to be involved, we have many different ways in which you can participate in the pop-up, and we're trying to be as flexible as possible in this era of COVID. So if you're interested in collaboration, in seed money for different projects, just in making sure that your voice is heard, please reach out to Yona, and we'd be happy to work with you. So thanks, Yona, I'll let you take it away. And we will be recording this session, so anybody who can't make it, they'll be able to access it later.
Thanks, Eliza, and thank you to our speakers from all the organizations that we're going to hear from today. We have Joe Anderson Jr. With the Kind Clinic and Texas Health Action, Ben Walker and Linda, who are with ASHWell, Sarah Kapistashi with Out Youth and Transgender Wellness, and Ina Ganguly with allgo. So I look forward to hearing about all that y'all have done and how you are navigating the COVID-19 crisis and ensuring care for all the folks in our community. So thank you all to all the work that you do, and we look forward to hearing from you. Looks like a couple of our speakers are still on their way here. So if y'all don't mind getting started, the way that we'll go about these PowerPoint presentations are each organization will do a short presentation. This Pechakucha style is traditionally 20 slides and 20 seconds per slide. So it's a very rapid kind of informational presentation, or it can translate into 6 or 7 minute presentation. And after which I fully welcome anybody who has questions to directly ask those questions either in the chat box, or you can raise your hand and we can call on you, or send us a private chat and we'll voice those questions out for you. And then we'll go on with the next organization and next round of questioning. So if y'all are ready, Joe Anderson Jr. with Kind Clinic, would you be willing to start us off?
Hi, everyone. Thank you for having me. And let me pull up my presentation. Okay. All right. Can everyone see everything? My presentation? Okay. My name is Joe Anderson Jr. I work as the events and special events and engagement manager at Kind Clinic. And what I do is try to curate experiences for people in the community. But as we all know, things are a little bit different and they're changing rapidly. So I wanted to talk about like what we're doing in response to COVID-19. Just to give you a very, very, very brief history, we were started in 2015 from grassroots volunteers, and we've expanded from not only doing free PrEP, but to HIV, STI testing and treatment, gender affirming care, and care for people living with HIV. And essentially what we want to do is to just serve anyone within the LGBTQIA community with care that's affirming to their identities. We have 3 clinics. Ignore the times at the bottom. We have one in Central Austin, one in North Austin, and we do have a clinic in San Antonio, and we're opening a 3rd clinic in Austin at the end of August. So for the time being, and I'll go into this a little bit later, we do have some services that allow people to come to the clinic, and these are the locations that you can go to. So if you know someone that needs the services, feel free to point them in these directions. And these are the services that we offer now. So PrEP and PEP access, gender affirming care, STI testing and treatment, general wellness exams for some of our patients, HIV testing and care, telekind, which is bolded because that is pretty much the move, it's the wave right now, vaccines and access to psychiatry as well. And all of our services are provided that we do in-house at no cost for people to participate in. What are we doing in response to COVID? For patients with follow-up appointments, they have been moved from coming in person to being a part of our telekind system. And I'll go into detail about that in just a moment. But essentially, what we're trying to do is to limit the amount of people that are physically coming to the clinic. And all they have to do is to have a face-to-face appointment through whatever mobile device they use, a tablet, a computer. And if they do not have access to any of those items or internet, they can also do a phone call to access our telekind services. For folks who do have to come into the clinic because they've been properly screened and vetted by our providers, they will have temperature checks prior to coming in, and then they'll be screened for COVID-19 symptoms before they can enter any of our Kind Clinic locations. And as far as staff is concerned, I just wanted to be clear, most of us are working remotely during COVID-19. And so the only people in the clinic are people that are deemed necessary and essential to be there. Before you come in and even have a temperature check, we do pre-appointment screenings. So someone from our team may call ahead to confirm that someone does not have cold or flu-like symptoms. We limit the visitors. A lot of our patients sometimes have friends that come in to ease the comfort of having services, but we're limiting that. And then we're also requiring people to wear a face covering when they come in. Telekind is our telehealth service that lets patients connect to a provider through easy to use, high resolution, secure two-way video conferencing. All that means is that people have access to the services where they are. And we also have, it's easy to use. They don't have to sign up for anything. It is a lot easier to use than Zoom and or Microsoft Teams. I can confirm that. And we also have some amazing services that our outreach team is doing. This is our drop-in testing. We are still offering drop-in testing for people that need access to our services. The times are on our website for the Central Austin location and San Antonio. It's a first come, first serve basis for new and existing asymptomatic patients, meaning that if you are experiencing symptoms for an STI, please call us. All patients that do drop in must wear a mask. They will be screened and have their temperature taken, and they will be waiting in their vehicles to come and get tested. If they do not have a vehicle or some type of transportation outside, they can wait in our waiting area, and we ensure that folks will be socially distant. In terms of events and engagement, and this is my area, I got this position right before COVID happened. And essentially what we did, we transitioned everything to more blog and virtual content. I am a Black queer man, and part of the events that we wanted to do was for people within marginalized communities within the LGBTQIA community, is to really create experiences where they can come together and form community. And so that has shifted to how can we create community virtually. And so we have a lot of live events coming up, whether that's a drive-in movie, a poetry night, things like that. And we really wanted to hone in on partnering with so many people who are doing amazing things in the community just to amplify all of our voices. So to wrap it up, what we're doing in response to COVID is everything that we've done before COVID. We've had to make some small adjustments in terms of our care, in terms of how we go about delivering our care. But what we have done is to ensure that people still have access to the services that we offer at an affordable price. And we just want people to be kind, and we'll continue to offer them the services that we have. Okay, I'm going to stop sharing and answer any questions that folks may have. Sorry, I have a timer as well, so 6 minutes exactly. I was like, I am not going over.
I just wanted to say, if anybody wants to put questions in the chat box, Yona or I can facilitate questions that way. I had one question for you, and that is, how do you see telemedicine impacting the relationship you have with your patients and the community? Do you see it as a benefit in terms of making things like prep easier potentially? Or do you see it as a barrier because there's that lack of kind of, community in some ways?
I see it both, to be quite honest. Obviously, when I think telehealth allows us to serve more patients potentially, because people can access care in an easier way for some, and whether that's some folks were driving from the valley to access some of our services. So now it's a little bit easier for them to access services from their own home. But a lot of our patients really, truly love coming into the clinic and experiencing that warmth from our staff. And so what we've tried to do is when we do call them and do get on the phone to pre-screen them, is to still give them that kind way, that kind compassion. And another thing that we try to do is to enhance our blog content, to make it very kind. Our brand is very fun, it's very innovative, and so we've ramped up a lot of the blog content so people still have that access to our voice per se, through some of the articles that we post or some of the videos of our staff twerking, channeling their inner Megan Thee Stallion. So we still want people to feel that warmth and that compassion, that hospitality from us, but it just has to be virtual right now. And even with our events, we want people to experience that safely and securely, but we have to find ways to do so.
How can people access your blog?
If they go to our website, and they click the news tab, that's where all of the content is. It's not a separate website, it's just under the news tab for now. Okay. And so we have blogs about how to have sex during COVID, blogs about our telemedicine that goes more in depth, or our telekind, I should say, and then even other content as well. Work It Out from Erica Nix, if you need to get your health journey kicking, we have a lot of content.
And another question I had was, I'm going to be asking this of all of the different presenters. If you had one wish, what would it be to kind of, if your community organization had one wish, And would you be interested in having a central website on our library's website at UT of all the community kind of resources that might be interesting or helpful to the patients that you serve? Like having your blog listed there and having everybody kind of go to resources.
Yeah, yeah. The answer to the second one is really easy. Yes. I think having one-stop shop for resources in general helps a lot of people because there is so much information right now. So it's important to, if we have a central location, whether that's Kind or any of the other organizations on the call right now, it's important for us to be able to point to one direction. And that also shows just us working together as a community, coming together to promote that. In terms of which, now I cannot speak on behalf of Kind, even though I'm representing Kind. It's hard for me to be like, what does an organization want? I think, PrEP for everyone, access to our gender affirming care for everyone that needs it, and expansion of our services. We have a lot of services, and sometimes funding can get in the way of that. Personally, a wish for me is for people to still feel connected to the community. And I say that because before COVID, we would host Black queer community events or queer people of color brunches. And for smaller communities within our overarching queer community, we have to text our friends and meet up and be in person to establish that connection in that community. And right now we can't do that. So how do we continue to be there for each other, to be there for our elders when we can't physically be there for each other? And so I wish that people, and my hope is that people still feel some type of connection to their community. And if not, let someone know, if that's Kind, if that's allgo, if that's ASHWell, if that's ASA, let an organization know so we can still be there for each other. COVID does not change the fact that we have to stand up as a community and be there for one another, be there for our elders, be there for people who are impacted by HIV, be there for people who have diabetes, anything like that. We have to be there for one another. And my wish, my prayer, my hope, my dream is that we still have that ability during COVID, post-COVID, whatever happens. Sorry, I didn't mean to go on a tangent.
Cool.
I do see a question in a group chat, and is it okay if I answer it? It says, how have your client numbers changed or not during this time? I am glad that I went to a meeting that I got invited to because they talked just about this. Overall, our numbers have dropped a little bit. I think it was 80. I can't remember the exact percentage, but it hasn't been a drastic drop. I think a lot of that is people experiencing stress during this pandemic, and in terms of sexual health, it may not be at the forefront of their minds. But we still have served majority of our patients during this time. And so our client numbers haven't changed drastically, really not that much at all, a couple of percentage points here and there. From Robin Atwood, what innovations do you hope to be able to maintain post-COVID-19? During my friends and I were talking about this the other night. Because of what is happening, we have been a lot more intentional in ensuring that we check in more with our friends, our family, and not to say that's innovative, but I do think because we're in this situation, we have to be a lot more deliberate and intentional in what we do. And so I hope that maintains. And even like as a staff, what we've had to do at Kind is really, there is no standard for how you deal with this or how to throw events during COVID. We are just flying and trying to keep the lights on and make sure that we're offering some type of content to folks. And so the innovation really is we can do anything virtually. Like we can talk about anything. And so I hope that feeling continues. And there is no set way of the table. We can create our own table, build our own, or not even have a table. We can have a desk. And so I hope that continues post-COVID. for not only Kind, but for all organizations as well.
Thanks
Are
so
there
much,
any-
Joe Anderson Jr., for all of that information and for speaking so beautifully and saying so many important things. I'd like to ask just one final question before we move on. So a lot of researchers in the UT community and the Central Austin community are affiliated with a pop-up in some way. And I was wondering if you had the opportunity to recommend any specific research for these folks, any point of interest that we should focus on as academics. Do you recommend a certain area of focus?
I don't know if I can answer that, or maybe I need a little bit more explanation for the question. Can you explain just a little bit further for me?
Yeah, so there are a lot of academics who are focused on queer research, and this may not be entirely COVID related, but
Okay.
from your experiences, do you think that we as academics should be focusing in any particular area? Is any place standing out to you?
I don't know if there's a particular area that I think people should automatically focus on. I do think there are questions that we may not know, and there's when we look at research for like events per se, we're always trying to figure out, okay, what are the gaps in services that Black queer people say, Latinx queer people say, trans folks of color experience. What are things people say? And there isn't a lot of that, I will say. So when we're looking at like, okay, in Texas, we did this study of XXX, what are some ways that we can continue to uplift and support trans women of color? Is not a lot of that. So I guess that will be my answer to what we should focus on. When I do read a lot of research, it is very white-centric. I also want to say when I talk to a lot of academics at conferences and stuff, the main thing they talk to me about is the research that comes out about HIV, and that's 1 in 2 Black men who have sex with men will contract HIV in their lifetime, and that is the first thing they lead with. Not hello, how you doing? What are some things that we can talk about for the Black queer community? But that is the first statistic and that is like kind of self-fulfilling in a way. It's like if I'm sitting in the audience and I hear that over and over and over in every presentation, at some point I'm tuning everything out and I'm not even trying to hear what you have to say.
Totally. Thank you so much.
Thank you. And thank you so much for having me. I appreciate it. It was a nice break in from meetings in my day.
I hope we're not all getting zoomed out, but alas. If you'd like to write any of your website information or any references to anything you may have spoken about, feel free to write that in the chat box. And everyone, if you still have questions for anyone, please keep the conversation going in the chat box. The folks from ASHWell are not here yet, so I'm wondering if Sarah Kapistashi with Out Youth would be willing to go next.
Absolutely. Hi, everybody.
Sarah.
Just give me one moment to share my screen, see if I can do this somewhat successfully. Okay. So just want to say I'm really honored and pleased to be here. I see a lot of familiar faces, and I really appreciate Yona and Eliza and the Pop-Up Institute for bringing us together today. So I'm going to talk a little bit about how Out Youth and the Transgender Wellness Program have pivoted during this time of COVID-19, and really want to leave a good amount of time for questions. So I'm going to start by just telling a tale of 3 clients that I think represent some of what we've experienced in this shift to virtual services. So first I want to talk about Casey, and obviously these aren't real names. So Casey is a youth and they still live at home with a family of origin. But the family is not super supportive of their gender identity. And this youth is also a parent, so has responsibilities related to childcare. And so the shift to virtual services has been challenging for this particular youth. So just hasn't had a lot of privacy to engage with our virtual drop-in or, unfortunately, the individual counseling services that they were receiving. However, we do have a leadership program called Youth Advocates and has continued to engage with that program. So that's a little bit about Casey. Next, we'll talk about Martin, who was a client in our school-based services program. So unfortunately, once school districts shut down due to COVID-19, we did have to suspend, obviously, our in-person groups. But the nice thing about Martin is he stayed in touch with me, and we have been doing some troubleshooting around pursuing a name and sex gender marker change. So has stayed connected to our services in that way and been receiving some support. And last, I'll talk about Francis. So Francis is a client in our transgender wellness program who was a high utilizer of services before COVID and has continued to be a high utilizer of services. So really seamlessly made the transition to our support groups on Tuesday nights, to individual counseling, just continued that really seamlessly, but has mentioned that there's peers he's aware of that haven't been able to make that transition for a variety of reasons. So just wanted to kind of give a little color for kind of our shift to virtual services and how it's looked across programs. Just want to briefly share just kind of what this has looked like to go virtual at OutU. So we have a section of our website really dedicated to our virtual services and our response. And obviously we have the banner at the top of the page that directs clients and everybody else to know how we're handling the COVID-19 emergency. And then thinking outside the house, we offer a lot of our services out of our Blue Bungalow, which we haven't been able to do, but we've really tried to offer as many programmatic and clinical services as possible virtually via Zoom. So I briefly wanted to just kind of talk about some things we're feeling good about related to this shift and some things we're still working on. So something we feel pretty good about is we were really able to offer all of our services virtually by March 30th. And so kind of the speed with which we were able to do that is something that we felt was helpful just to keep that continuity of care, especially during a very stressful time. I will say that there's been variable adoption of services based on the type of service and client access issues. So for example, almost all of our individual counseling clients continued with us in virtual counseling services via Zoom, but drop-in attendance has dropped for us on the youth side, as has attendance across all of our support groups. So that's just been a reality that we're trying to think creatively about right now. Both something we're feeling good about and a challenge. Something we're working on is promoting staff self-care. I think it's really important for me as I oversee my clinical team to remember that we are also experiencing this global pandemic. And so we have feelings and a lot of things in our lives have changed as well. So just keeping self-care centered as we try to offer the best services that we can. And I will say, shifting quickly and meeting time-sensitive client needs in this kind of first phase of response, but then also really shifting now to thinking about how are we going to continue to function in this new normal and what can we do creatively to help this access issue for clients, and what are we really called to be doing as an agency. And I will say one thing we've really felt called to do is shift to really having a focus on social services and financial support. And so one thing that we have been able to offer is some direct financial assistance to clients through a partnership with the Family Independence Initiative. We've also had a donation of and used some funds to purchase HEB gift cards for clients to distribute. We recently received some transportation codes via Uber that we're going to be distributing to clients, and also are launching a hygiene closet. So those are some really important things that we have just started to offer, because we recognize that in that Maslow's hierarchy of needs of this pandemic, we want to really be able to help people with very fundamental needs as we make it through this time. So one last thing I'll mention, and I'll put this in the chat as well, I'm not sure how I'm doing on time, but we do have a lunch and learn coming up next Thursday. And it's specifically led by some of the social workers on our team about social support for the trans community specifically during COVID-19. And we're running that through a coalition that we're a part of at Out Youth. So with that, I will go ahead and conclude and open it up to questions.
I'll start while people are formulating their questions and putting them in the chat box. Thank you so much for the presentation. As always, you are doing amazing work. What is, if you could formulate one wish for support for your organization as a whole, what would that be?
Yeah, I think right now, given our sort of shift in our laser focus on moving into providing some direct time-sensitive support to clients specifically, I think being able to write grants and fundraise around that piece of things would be really lovely. So I'm just gonna keep it real. I mean, for everybody, I think in the nonprofit sector, we're also just concerned about income to support our agencies in general. And that's a reality. That's why I'm glad I'm not an executive director and I don't have to worry about that. So I really wanna focus on how can we, you know, get some fundraising going and some resources going that we can give directly to clients. So that would be my wish.
That makes a lot of sense. Any other questions? I have one more follow-up to that then. I'm trying to think about how we at the Pop-Up Institute can support all of the work that you guys are doing. One thing that comes to mind based off of that request is the fact that we have a bunch of researchers who day in and day out are very expert at grant writing and about pulling in research dollars to support different programs. Would that potentially, you guys as, you know, the organization that you are and a nonprofit are also very good at that and know how to do that. Would there be any utility in collaborating or working with the university in terms of getting more of that, of doing research projects that could potentially also supplement income for your organization? And if so, who do you think would be interested in talking to people about that?
Sure. Yeah, I think I'd have to wrap my brain around that a little bit more thoroughly, but we have had really lovely partnerships with researchers before, particularly developing a curriculum for our school-based services program. And so we are familiar with that type of partnership. I think for us, it's just really thinking about you know, ease of some things like, you know, reporting and what certain researchers are needing, and also being really protective of all of our clients, certainly, but particularly of youth clients around, you know, confidentiality and how much researchers want to be up in their business. So generally speaking, I would say yes, but also just with the caveat that I think just finding a really mutually beneficial relationship in that way is really important. And I'd be happy to chat with you about that anytime.
That sounds great. And then I think somebody, Joe is asking if you could post the link to the Lunch and Learn, and then we'll also promote that on our library website. And I will put the link to our pop-up library website on here. We're hoping to make it kind of a repository of resources that people can go to and learn about different resources in the community as well as research. And Yona, maybe I'll let you take it over for whoever is up next.
Sure. Sarah, thank you so much for talking and for sharing some of what y'all are doing. It's really amazing work. And I was wondering if I could ask you one final question. If you see any opportunity for collaboration between nonprofits in this time or in general do you have any ideas that come through your head for ways that nonprofit organizations can work together at this time?
Yeah, that's an excellent question. And I'm really all about collaboration versus competition. And I think we do have some pretty good relationships going on in the Austin community. We have a formal partnership with the Kind Clinic, for example. We refer to allgo all the time and really want to highlight the amazing resource guide that they've put together during this COVID time and that lunch and learn that we referenced. That lunch and learn is being put on by a coalition in and of itself that, you know, tries to bring together different representatives from agencies and organizations to talk about trans responsive health. So, but I think we could always be doing more. I think especially right now in terms of being able to provide financial support to clients potentially. I was really happy that the Family Independence Initiative selected us, and we partnered with Kind and selected allgo to provide direct financial assistance to clients. And so I think having more big picture nonprofit collaborations in a lot of different spaces is really going to help clients access resources in more efficient ways right now. So sorry if that's a little bit of a rambling answer, but that's what I got for right now.
No, that was great. Thank you so much. And if we could pivot to allgo, that was a good segue into allgo. You know, if you'd be willing to take the mic, and we're all ears.
All right, thank you. Let me see if I can share the screen. It's weird because sometimes it'll stop sharing. Yeah, bring your shared window to the front. Okay, let me stop it and do it again. Share screen. Okay, can y'all see it? Yes? Okay. Hi everyone, my name is Ina. My pronouns are she, her, hers. I'm the Health and Wellness Coordinator at allgo. And a little bit about allgo. We are a queer people of color organization. We were founded in 1985, and we're a grassroots community-based organization. So everything we do is for the community, by the community, of the community. And we've worked for close to 35 years, we'll be 35 this October, to nurture and celebrate queer people of color by building, educating, and mobilizing communities towards a just and equitable society. So you can reach out to me at wellness@allgo.org, and you can reach out to my ED, Priscilla Hale, at allgo@allgo.org. So there's some contact info there. And then I've placed a few sort of, you know, past events on this slide. So we've had some different programmatic stuff happen, and we usually work through 3 different programs. So I, as the Health and Wellness Coordinator, I'm responsible for the Health and Wellness program. So I put together conversations for queer people of color to engage in that relates to their health and their wellness. So as you can see, one of those events were on asexuality. And that was a great event. It was incredibly informative, as well as bonding. You know, a lot of folks who attended were like, I don't know any other asexual queer person of color. And so they were able to really connect with each other in that space. So that was amazing and great to see in real time. We also do our health fair every year, which is the banner at the bottom of the slide. This was from last year. But we call it a community healing fair. So we try to get a bunch of community healers who are queer people of color to do direct services for attendees, like yoga, acupuncture, sound therapy, intuitive counseling, herbalist consultations, as well as get local community organizations to attend and table. And then we also have our cultural arts program, which is the one that you see at the very right. It's our community showcase, and we also do plays and what is it called when you're performing arts? We do a bunch of different, you know, the umbrella of cultural arts is so beautifully diverse. So we do a lot of different things under cultural arts as well. And then our last bit is social justice. So I'll get into that a little bit in the next few slides, but social justice really is a part of our culture at ALGO. We want to be equitable and we want to be socially minded. We want to have social justice in mind as we are implementing these programs. So it's definitely something that is kind of embedded into all of our programs. You know, it's not something that's like a standalone. And then we also mobilize communities and work with local grassroots organizations and make sure that the marginalized folks in the city are able to access resources. So that really will come up later on, especially at this time. So ALGO's response to COVID-19 has looked like a lot of different things. We're currently collaborating with TASA. Some of you may know TASA. Stands for, I'm gonna get it right, Texas Association Against Sexual Assault. And they're an amazing organization. So we've been collaborating with them to create a virtual healing series. And so we've been featuring one BIPOC healer, so Black, Indigenous, person of color healer every month. To kind of talk about their journey as a healer and then to actually perform some form of their healing work and then to have Q&A and some community dialogue. So that has actually been going great. We had a sound therapist, Gabeda, do a session at the very beginning of this series, and then La'arni, who is a Filipina Hilat medicine woman, also queer, you know, just amazing, wonderful kind of space to talk about what does healing mean to us right now and how can we heal at this time when so much is kind of uncertain and we're feeling a lot. And so the next thing we're doing is holding community conversations, kind of quote unquote in-house. So this is in line with our health and wellness program. So we've been hosting space online to kind of get people to talk about how are you feeling, you know, that there are other people feeling like how you're feeling right now, we're not alone, and just have space to really process the recent events. And so Martha Ramos Duffer was extremely gracious in offering her facilitation expertise to us. So she facilitated about 3 of these. And so we're gonna be having another event on June 9th. I believe, yes, June 9th, called Loving Ourselves in Any Size. So that's for fat queer people of color to really talk about how they are doing at this point and just connecting with each other and kind of uninternalizing some of the fat phobic messages circulating around this pandemic. A lot of people have been terming COVID-19 as COVID-15. So kind of just unlearning some of that, right? And our another thing we've been doing is we created a COVID-19 impact survey. So this is specifically to gauge if our communities are in need of food, because we do have some resources. So we want to be able to reach out to folks if they are saying, you know, we have an urgent need, we're running out of food, so we're able to reach out to them. But it's also a bigger kind of survey to just gauge, like, where are our people at right now? How are they doing? How can we support them at this time? So another thing that we've done, which I'll link these in the chat, is our resource list, which I believe Sarah mentioned, so thank you for the shout out. Our resource list has been basically a compilation of everything that is available to folks. Pretty much in Texas, there have been some resources that we've put on there that's in Houston too. So it's not just Austin. And that's hopefully has been helpful to folks. It's pretty comprehensive and it's getting pretty long, so that's exciting. And all the resources that organizations mention here, I'd be happy to include in that resource list. And then blogs. We always write blogs. We try to do a weekly blog. And like Joe said, it's kind of a way to maintain our voice in the community and to engage with our community, especially at this time when we're not really able to see each other like face to face like that. But our blogs have been really something we've been intentional about and really trying to keep up with so that folks have something to touch base on with us, especially because they don't really see us otherwise. And then social media engagement. So not just posting about ALGO's events or ALGO's blogs, but posting about, what's happening in the city, what's happening with other organizations, what are some virtual events that people can attend for their own betterment or for their nourishment. So we've been trying to do social media engagement that's beyond just what we're doing. And as a way to also continue building relationships with folks that, we've been collaborating with. And lastly, we are providing tangible assistance. So like Out Youth, we were also in partnership with the, I believe, Family Independence Initiative. And so we were able to distribute some direct cash assistance to our communities. We've also been, we're also part of Communities of Color United for Racial Justice. So that's part of our social justice program. And we have been raising mutual aid funds for RESN, so it stands for Racial and Economic Solidarity Network. So we've been prioritizing Black and Latinx undocumented folks and have been raising, I think we've raised probably around $60,000 at this point. It might be more, but we've raised around $60,000, which is amazing, and all from Austin community folks who are able to give and have been able to distribute that fund to folks who are in need and can't really access, government funding or don't have the wherewithal to be able to work right now, stuff like that. We've also been distributing personal protective equipment like masks, gloves, stuff like that, and then personal care products like soap, hand sanitizer. So that's kind of where our direct, immediate assistance is looking like. So challenges to care for our communities, there are lots of challenges right now. I think something that immediately popped up for me was transportation needs. A lot of folks take the bus, and the bus has honestly, I think, been a source of anxiety for a lot of people. And it's scary to get on the bus right now. So definitely, people who usually go to their appointments using the public transportation system are feeling a lot more anxiety. They may still be using it, but there is that challenge of getting on the bus, especially if you're struggling with mental health episodes or mental health illnesses of any kind. It exasperates that challenge for sure. A lot of our folks have been furloughed. People have been, if they're working hourly, their time has been cut considerably. So there is a dip in income, and that poses a challenge in terms of paying for, your appointments. And a lot of our communities have been stepping into caretaking roles. So, if they have kids, they're having to really take care of children. Even if they don't have their own kids, having to be in a household with kids, they're having to step up and provide childcare. And a lot of folks also live with vulnerable people. They themselves are immunocompromised. So there's definitely a challenge to really navigate the healthcare system right now, being somebody who is a queer person of color and already having that. Already having to navigate so many phobias and isms, but you're putting the impact of a pandemic on top of all of that. So it definitely is very much exasperated for our communities. And then, of course, a lot of our folks don't have insurance, or if they do, they're underinsured. So they're not really able to access some of the care that a lot of these healthcare providers are giving right now, mostly because they can't afford to go. And then they're also unable to access telehealth. So Joe mentioned that, some folks are unable to access telehealth because they don't have Wi-Fi, or they might not have the electronic devices. So it's great to know Kind Clinic provides a call-in, but it's also difficult to really build a relationship over the phone. So it is definitely great to know that Kind is also providing folks to come in person and making sure that people are safe in doing that. But we've heard from communities that they are kind of feeling a lot of things trying to access telehealth as well. And so ALGO's needs right now is basically, it would be nice to have more tech stuff right now. It feels like everything is tech. So iPads or Mac computers, some stuff like that would be great. We're all currently working from home. We do go to the office every now and again to provide folks with the things that I mentioned earlier, like masks, gloves. We do runs where we'll drop those protective gear off or provide the personal care off. And then we're also, giving folks money. So we're also having to go into the office to give volunteers direct money to give to the communities who are impacted at this point. And I'm happy to take questions now. And that was a lot of information. So I think maybe someone has said something on the chat too. I'll check. Okay. Oh, thanks. Thank you, Lisa. So any questions, if y'all have any, I'd be happy to take them.
So while people are thinking, I'll ask you the same question. If you had one wish for your organization, what is the primary wish that you might have?
That's a great question. I definitely feel like we're struggling with trying to create, and it's just a matter of time and just being able to do it, but creating a kind of, I don't know if momentum is the right word, but just being able to have that, have ideas to like nurture community space virtually, because it is very hard. And I think, there are like these memes and like beautiful graphics circulating on the internet about how even doing this, like being online and talking to people in this forum can be very anxiety inducing because of lag time or, body language, people or like having to like see yourself all the time, but people feel like, man, this is exhausting. So I wish, ideally it would be nice if we could see each other, but honestly we can't put our communities at risk. So we're having to do this virtually. So how do you create a healing space in a space that also creates so much anxiety? But we're trying. And so I guess my wish would be, I wish virtual space wouldn't be so anxiety inducing, and that it would be more programmed to be more like healing and really community centered. And it's interesting the way that technology is set up to where you do have to look at yourself, or you do have these time lags, or these, it's just very interesting. I've been thinking about that a lot, but that would be my wish, is to cultivate more healing space virtually and to do that in a way that's not anxiety inducing.
That's a really interesting point. And yeah, it sounds like the ability to really be in the same space as other people is really important.
Yeah.
I'm wondering about how, if there's any way that we could create, guidelines for safe social distancing while I'm just envisioning like, group therapy sessions or group get-togethers where there's enough space to socially distance, and like people wearing masks and being, 6, 7, 10 feet apart, but still being able to be in the same space. Again, that kind of depends on everybody's comfort level, but that would be nice if there are spaces big enough to support that.
Yeah.
We did a volunteer run face shield project where we created a whole bunch of face shields for the community. And we're able to do it in the Austin Convention Center because it's so big and it's not being used. And so we were able to space people, 10 feet apart, and everybody wearing masks. So just an idea about how, if there, space is also a premium. So, nobody has like big warehouses just available, but perhaps if there's, some sort of ability for small groups to get together like that, it sounds like that would.
And that actually makes me think, I think the more realistic wish would probably be, because I'm like such an idealist, I'm like, oh, this would be our vision, but honestly it would be nice to have more protective materials for folks, like gloves, masks, things like that, because I have eczema, so like I definitely always need gloves, and thankfully I'm able to access it. But I can imagine, you know, for other immunocompromised folks like who are dealing with the barriers right now, how they're able to continue accessing gloves and masks and stuff like that. So definitely more of that. I feel like that's more real. It might be basic, but it's definitely more realistic. Like I wish we had more of that available. Yeah.
Are there any other questions? Well, I'll let Yona end things, but I did want to say that I did put in the chat our library resources page. And I'm wondering if I can share the screen with people. Our goal is to create a resource page. Let me see if I can. Or Yona, perhaps I don't know if I'm allowed to share the screen, but I put the link in there, the guides.lib.utexas. And it's just in the process of being built out right now. But if there's any feedback that you guys have about how we can better feature community organizations and make sure that the resources are clear. So you can see on the side here, there's a bibliography for this information for community members and community resources. We want to build that out. And Yona, can you click on one of those? And just, I think it's not very well built out right now, but we'd love to.
It's an image, I can't click on it, but but the website's a real thing. You all should visit it. I'm gonna put a link into the chat box.
Yep. And we will be sure to start posting the resource list, the blogs that y'all have created, and we'd love to also feature events and things like that. With that, thank you guys. Yona, are you aware of where on the library website we're gonna have this video recording?
I believe it'll be on the events tab. And
okay, events resources here.
Yeah, we may have like a brief blurb about what the event was, and a shout out to all of y'all and all of the work that you've done. Also, if you're willing to share speakers, if you're willing to share some of what you presented, I can compile a slideshow and share it with everyone. So if y'all want to be a part of that, then go ahead and write your email in the chat box, and I will make sure to try to relay all this information to y'all. And feel free to reach out to me as well. I'll write down my email.
And Yona will be sending out regular, I think, weekly or bi-weekly updates on a listserv about different events and what we're doing. So if you want to be on that listserv, put your email in the box, and we will be continuing to do content like this at least weekly, and then we'll have a burst of activity in October with a lot of different speakers and events, probably a lot virtual. At that time. Well, that's all I have. We want to be
Elisa, can you repeat yourself?
Oh, thank you, Liz. I just said thank you all for coming, and we'll make sure to incorporate the emails here on our listserv. And that, I don't know if I said that we're going to have a burst. We're going to continue to have these kind of weekly sessions just to have everybody aware of what everybody else is doing in Austin and kind of get on the same page. And then we're going to plan for a burst of activity in October, where we'll have a lot of nationally recognized speakers and community organizers for many different events throughout the month of October that will kind of kick off our pop-up. But we hope to really create some sustainable resources that people can use far into the future, starting with this website and making sure that we just all get to know each other. So thanks for participating.
Thank y'all so much for participating, and all our speakers for speaking, and feel free to write us if you need to. and we'll see you next time.
Thank you.
Thanks, everybody.